Welcome to the Invite Health podcast, where our degreed healthcare professionals are excited to offer you the most important health and wellness information you need to make informed choices about your health. You can learn more about the products discussed in each of these episodes and all that Invite Health has to offer at www.invitehealth.com/podcast. First-time customers can use promo code podcast at checkout for an additional 15% off your first purchase. Let's get started.
Having good oral health is so much more than just a bright white smile and having no cavities. Today I want to talk about the impact of periodontal disease and how common it is in this country and what you can be doing when it comes to your oral health. And this is really important because when we think about all the different chemicals that we expose ourselves to, oftentimes we overlook putting things like toothpaste into our mouth and mouthwash. And all of this is really very valid when we think about our overall health and wellness, because we don't want to be adding in chemicals when we don't need to, when we have alternatives that are coming from nature. So I'm going to talk all about oral health care today. I am Amanda Williams, MD, MPH, and we know that periodontal disease is quite common here in the United States. Obviously, people can get dental caries, which are known as cavities, but when someone has more significant inflammation within the gums and the periodontis, then this can be a very aggressive condition that can eventually lead to tooth decay and tooth loss. And roughly about 20% of people 65 and older have untreated tooth decay, and approximately half of all U.S. adults over the age of 30 have periodontitis, meaning that they have that inflammation that is occurring within the oral cavity. Now, it's not just limited to your mouth, and this is the important point to walk away with. We understand so much more now that oral hygiene is certainly more impactful on our health than just oral health. We know that it's been linked to heart disease, to diabetes, to chronic kidney disease, even Alzheimer's disease, as well as osteoporosis. So we know that we have to pay attention when it comes to oral health, and we have to make sure that we are helping to regulate any type of inflammation that is occurring. So we know that that chronic low-grade systemic inflammation is a major indicator for all chronic diseases, and we know that one of those triggers for that happens to be periodontal disease. Now, the important thing to know is that there are so many things that you can be doing to make sure that you are maintaining the health of your oral cavity. So we think about the gingiva, which is your gums. And then we have, even further down when we start to get into the bones. So we want to make sure that we don't have improper bacteria that's lingering about. They always say that, a human mouth is much more filthy than, say, even the mouth of a dog. And we know that this is the case because of that broad array of different bacteria that reside within our oral cavity. So we want to make sure that we are doing everything in our power to limit that inflammation and maintain the health of our teeth and our gums. And all of this is really relevant because we don't want to have a potential for cardiovascular disease or type 2 diabetes. We know that periodontal disease happens to be one of the main complications when it comes to diabetics. When people have COPD, for example, we know that periodontal disease can actually exacerbate the situation with shortness of breath in patients who have COPD. When we look at cognitive decline and memory loss, if we have that imbalance of those bacteria residing in the mouth and inflammation, this can actually trigger, once again, poor cognitive function, autoimmune conditions. Certainly, if we have that dysbiosis that's beginning within the mouth, this can trigger an autoimmune response. So there are many different reasons as to why someone can have problems with oral health. And predominantly we usually focus in on that dysbiosis, and that's thought to be one of the primary drivers of the main cause of periodontal disease. So dysbiosis is when we have basically kind of these disease-causing bacteria that generate inflammation, and they start to break down the teeth as well as the gums. And so then you fall into that category of having dental caries and periodontal disease. And we know that there are certain relative risk factors that go along with this. We can look at metabolic syndrome, for example. They have been able to correlate metabolic syndrome with an overall increased risk for development of periodontal disease. So this is why going in and having regular dental appointments with your dentist is always very key, because if there is a significant amount of inflammation going on or breaking down of the tooth itself, or if they can see even further down that there is damage done to the actual bone within the jaw, then of course you want to make sure that you are taking all precautions in terms of targeting that. So let's talk a little bit about some of the things that we can be doing. Well, first, we know that we can look at diet, and diets that are high in sugar and processed starches certainly are going to increase that risk for the development of dental caries as well as just tooth decay itself. So we know that things such as fresh fruits and vegetables actually help to enhance saliva flow, which is very important because the more saliva, the more that we can wash away those things from sticking and adhering to the teeth. We certainly know that proper dental hygiene, brushing your teeth is going to be very important. But then we also have to look at probiotics and making sure that we maintain a healthy microbiome environment. So taking something such as probiotic HX on a regular basis certainly would be advantageous. But I really want to hone in on what you use to brush your teeth with, because when it comes to this, I'm always amazed by the amount of chemicals that are just in traditional toothpaste, where I'm like, oh my goodness, like what are those chemicals? I know people have been using them for decades, but we don't really know exactly what those chemicals, their long-term impact is. And I always say, if we can avoid putting chemicals into our system, we should certainly do that, which is why we have our periodontal White TEAth Gel. So this contains white tea. And we know that EGCG, that epigallocatechin gallate coming from the tea itself, is a very, very powerful antioxidant that helps to fend off oxidative stress and free radicals within the mouth. And what we're trying to do is we're trying to support a healthy balance of those bacteria. So by utilizing the White TEAth Gel every day as your toothpaste, you're going to get this wonderful antioxidant power of white tea extract, but it also has coenzyme Q10 in it. It has zinc, vitamin C. Why are zinc and vitamin C important? Because when we think about the wound healing properties and cross-linking of collagen, for example, we know that we have to have vitamin C and zinc. If someone is recovering from any type of an injury or illness, vitamin C and zinc are essential to that healing process. So this also contains really wonderful blend of different herbal extracts, including it has myrrh, it has olive leaf extract, it has a peppermint oil in that. So natural peppermint. It's not like, oh, this is mint flavored. This is natural peppermint. And this really helps to optimize the overall microbial environment, at the same time allows for a really lovely natural way to clean your teeth. And what we know about coenzyme Q10, certainly there's been a ton of focus of CoQ10 when it comes to heart health and when it comes to brain health. But there is certainly now evidence that when someone is low in coenzyme Q10, that periodontal disease is much more common. They've actually been able to find deficiencies of CoQ10 in the gum tissue of patients who have periodontal disease. So this is really a interesting point, because when I talk about CoQ10 or ubiquinol, we know that coenzyme Q10 plays this role for cellular energy production, but also as an antioxidant and found throughout the body. So while we predominantly focus in on areas of high energy output, such as the heart and the brain, we cannot overlook the fact that there is this very strong relationship in coenzyme Q10 and oral health, and it's very important in easing inflammation as well as regulating oxidative stress. They have done human clinical trials utilizing coenzyme Q10 in patients who have significant gingival inflammation, so severe gingivitis. And they found that when they gave them oral coenzyme Q10, that this actually helped to have significant improvement in their periodontal health. So this is a really good reason as to why someone would want to be using the White TEAth Gel. So we have that zinc and we have that vitamin C, because remember, every time you brush your teeth, we create small amounts of damage to the gums themselves. And so while you may not see it, you're not, have significant periodontal disease where you're having bleeding of the gums, but we're still creating this abrasion. And we want to make sure that we have vitamin C and zinc to allow for that proper wound healing. And then we have that coenzyme Q10 to help to support a proper inflammatory response. At the same time, it works synergistically with the white tea to make sure it's fending off oxidative stress to really optimize that microbial environment. So go to our website and check out our White TEAth Gel. This is a really great option for you to consider when it comes to your oral healthcare routine. So that is all that I have for you for today. I want to thank you so much for tuning in to the Invite Health podcast. Remember, you can find all of our episodes for free wherever you listen to podcasts or by visiting invitehealth.com/podcast. Now, do make sure that you subscribe and you leave us a review. You can follow us on Facebook, Twitter, and Instagram at Invite Health, and we will see you next time for another episode of the Invite Health podcast.